Hello and welcome to Basin Safety Training's monthly safety trainings. This is your safety instructor, Jonathan Greiner. This month we're going to be covering bloodborne pathogens, first aid and CPR, and pandemic preparedness, otherwise known as COVID-19 safety. Thank you very much for tuning in. Glad you're all here. Glad it's a new year. With that, let's get this safety started. Alright, so we have some course objectives we're going to be covering today. First of all, understanding bloodborne pathogens, what they are. Understand how disease is transmitted, specifically bloodborne pathogen diseases. Understanding both personal risk and how to protect yourself from exposure. Appropriate and immediate response methods, what the right thing to do is and when you should do it, as well as understanding medical evaluation rights and protection for yourself, making sure people receive appropriate care if they're injured or if they're sick, and lastly, maximizing operational tempo while minimizing risk. Why this is important and why I put it in here, last year I put, ensuring that people don't go insane during a pandemic situation. I don't think I used the word insane. I think I used hysteria. But, the goal in any major situation is to keep things moving forward. Depending on what's appropriate, right? We don't want to say, oh, Billy broke his arm, let's just keep going. Billy, just walk it off. Here's some dirt, rub it on there. We have to understand, okay, the severity of a situation needs to be assessed effectively to determine next steps rather than, losing your mind. And that's a big issue with first aid and CPR, as well as anything, and specifically kind of how, the pandemic was handled, just not thinking it all the way through of what the long-term impacts can be and making the best decision moving forward. So no, I'm not going to go super political or super deep on you with that. Just something to kind of, put up underneath your cap there as we're going through the training. A big part of this is being prepared, taking the necessary steps to keep moving forward and making sure you're making the right decision with the right information at hand. So first off, what are bloodborne pathogens? They are microorganisms that are present in human blood and that cause disease. So a virus would be considered a bloodborne pathogen of any kind, a bacteria, parasites, fungi, etc. The big ones that we are concerned about with in the workplace, typically and most commonly in emergency medical services such as EMTs, doctors, nurses, nurses' aides, emergency room professionals, etc., are HIV, hepatitis B, and hepatitis C. So HIV and AIDS. A lot of you guys know this, especially if you were born before 1980 or any time during that period. It was a big thing back in the day. It's kind of quieted down. A lot of medications have helped that, but HIV does lead to AIDS. It attacks and depletes the human immune system, which is the reason it's so scary. Early symptoms resemble the flu. HIV antibody test is the only way to know for sure if someone has it. It does not survive outside of the body for any reasonable period of time. And even though there are medicines to help treat it, there is no cure. And that's one of the main reasons that we're concerned about it. Hepatitis B, this is a pretty common disease out there. It is serious. Some symptoms include jaundice, fatigue, and abdominal pain. No appetite for food, nausea, and vomiting are all kind of in that. There is a vaccine for hepatitis B. In fact, we'll cover that here in a little bit. And this one does survive outside the body. In fact, for a long time, at least a week in dried blood on surfaces such as a work table, knife, tools, broken glass, etc. And that's why it's important, and we'll talk about this in a little bit, is our work practices, especially if you're dealing with somebody's blood. It's important because a week is a long time for something to just be out there hanging out. Hepatitis C, it is the most common chronic bloodborne infection. About 3.2 million, or about double the amount affected by Hep B. And symptoms can take years to manifest. So flu-like symptoms, jaundice, dark urine, fatigue, loss of appetite again, nausea and vomiting. And treatment is marginally effective. There is not a vaccine for this. Hepatitis is kind of, it's one of those diseases that, affects the liver. It also can be contracted or, essentially you'll get it very easily if someone has a drinking problem. Hepatitis is very common with that, as well as diabetes kind of work together with that. There's another one, hepatitis D and even E. I don't think it's gone to F yet, but as it progresses, they kind of add more letters, just like they're doing with the COVID, except for whatever reason with COVID, they're using Greek symbols, which I don't really understand why they're going that route, and they're just skipping certain ones based on who it might offend. And anyway, we're not going to get into that, but the hepatitis D, a lot of people don't know a whole lot about it, but essentially it's a dormant virus that's only purpose is to blend with hepatitis B to make make somebody much more sick. So if just for posterity there, you know that. Transmission is pretty easy to isolate and determine how it's transmitted, unlike some other things out there. Basically, if a sharp or a needle is contaminated with it, it can be passed to another person if that sharp or needle punctures that person's skin and gets into their bloodstream. As well as broken skin if there's blood there. Mucous membranes can also transmit some pathogens, not all pathogens. For example, HIV is not transmitted through mucous membranes, whereas hepatitis can be. So routes of exposure, again, contact with bleeding coworker. If you're somebody taking care of somebody and you're not using gloves, etc., it can be transmitted. Same thing with administering first aid, even if you touch a contaminated surface. And that's where, this requirement for this training became so pertinent, is because people were getting sick just by, other people not cleaning stuff up. And so, that's where they really put this out there and said, hey, we need to train people so that they really understand the hazard of not cleaning up surfaces. Now, me, myself, I don't know, I just grew up with siblings and we were all pretty accident prone. So cleaning up blood, not fortunately large amounts of it, but that was just, part of growing up. Like, hey, you clean that stuff up because it's gross and you don't just want it everywhere. Kind of surprising that people need to be trained that, but yes, if there's blood and someone's been hurt, clean it up with some bleach, get something, what else are you doing? Also, contact with contaminated products or equipment in restrooms, and then using a tool covered in dried blood again, just maybe a bad omen there Billy just cut his arm off with a saw, let me go use it to cut some 2x4s. It's a little bit strange without just cleaning that up. So the Bloodborne Pathogens Law, real quick, essentially it requires that there's a medical surveillance program where if, somebody does get infected or somebody does get exposed, then they get tested right away. Because again, just like anything, somebody who doesn't know they're carrying something can be a little bit, it can create a worse situation than already exists. Hepatitis B vaccination is free to any worker in America, but typically really only, the people that are going to get this are going to be people who are consistently working around blood, such as, again, EMTs, doctors, nurses, etc. Signs and labels are other things that we use, and then there's other engineering practices that people use. So, universal precautions, and then again to prevent hysteria. Basically, if you see blood or any sort of mucus or something from somebody around, treat it as though it's infected. If you see somebody bleeding and you don't know their entire medical history, even if it's a nosebleed, don't just start touching that part of that. COVID-19 has changed things a little bit where people are a little bit more apprehensive to just start touching others. But, in a first aid situation, this can happen. So also barriers such as gloves, which would be considered a barrier, aprons, etc., to avoid contact with infected body fluids. And then again, I know I've beat this to death, but immediately clean it up. Don't just leave it out there, potentially affecting other people. So I already mentioned gloves as PPE. That's probably the most common. Gloves and masks in medical are pretty common. And then same, whether you're applying a bandage, even if it's gauze, even if it's something small, if you're touching another person and there's any bodily fluid coming from that person, good idea to wear gloves. Also masks, as I mentioned, and then spray guards, face shields, etc. So this is, we're all very familiar with these. There's KN95s. If you're giving CPR, it's a good idea to use a CPR mask for that purpose, which is essentially like a one-way valve where air goes in, but any fluids or other things don't come back to the person who's admitting CPR. And then be prepared to use impromptu barriers such as a garbage bag, plastic, paper, even your shirt. Depending on the situation, you may not have a CPR mask around. but you need to help somebody. So there's other ways that you can kind of protect yourself. And again, with the breathing, the respiration during CPR, its effectiveness is kind of in question. But moving on. Avoiding puncture wounds is another big one. So if there is a contaminated item, especially a sharp or even glass, they don't want you to be picking. Now at home, you may be a little bit bold. You drop a glass, or your kid drops a glass, and you're picking it up like a superhero. Not cutting yourself. Superman and kryptonite, just not no damage at all. But at work, don't take the risk. Use a broom. If there's something that could potentially cut you, obviously using cut-resistant gloves while utilizing those tools is important. And then if something does get contaminated, even if it's you and you just nick your finger or something, clean it off. Don't just be like, it'll be fine. My blood's okay. Just as a good practice. Again, everybody should be cleaning everything if it gets dirty or contaminated. So gloves and glasses are pretty common for PPE. There is such thing as a bodily fluid disposal kit. Again, we're not typically working with that. We're not going to have those usually at your typical workplace, but if you're in the medical industry, definitely. And then, as far as a bleach concentration, you can use 100% bleach on stuff, but it's pretty strong and not necessary. 10%, 1 to 10 parts is usually I think 2 capfuls a gallon or something. I have to look up that ratio, but 1 to 10, so there's about an ounce in a capful, compared to 10 ounces. So just keep that in mind. And then dispose of contaminated items, if anything is disposed of. And if it's a sharp object, there's different ways you can do it. You want to use a paper or absorbent towel to soak up residual liquids. And then depending on whether or not it needs to go in a biohazard bag, really depends on amount, first of all. Second of all, if whether or not we know that person has something, which you're not always going to know. But again, depending on the amount of blood or bodily fluid, a biohazard bag may not be required. Again, you get a nosebleed, and you got a couple drops that came down, it's dry outside, you blow your nose, there's some blood on it. We don't need to shut the whole location down, get the helicopter flying in. Again, I want to talk about reality and preventing mass hysteria, because that's just something, I guess, in 2021, 2022, you have to remind people of. So again, biohazard disposal, not typically, in our daily bailiwick, but, they do have sharp container boxes for this purpose. And then again, regulated waste, and there's a definition for regulated waste, and any regulated waste does need to have the biohazard tag on it. Again, a major reason for this is back in the day, at hospitals, doctors would administer shots to people, break the needle, and then throw it in the trash bag, just the regular old paper basket. And a janitor would be cleaning up, pick up the basket or the bag from the basket and swing into their leg, jab them with a needle, and they'd have Hep C, and that's just not a great thing, so they created the sharp boxes for that. And then also, if there's some sort of danger, it's going to be labeled. So if I'm Billy going in there to clean up something as a janitor or waste staff, I'm seeing the biohazard bag as a definite hazard rather than just treating it like any other recycling paper box or something. So exposure incident, if something does occur, just like any incident, you need to immediately report it after providing care and response. So wash, cut, and skin thoroughly, rinse nose and mouth, flush eyes with water or clean sterile solution, clean all the contaminated surfaces again, with bleach or other antibacterial material, and then report it. Then there'll be an evaluation. If this does happen, the doctor's going to talk to you and say, hey, how are you doing? Let's do a blood test, etc. That's pretty standard requirement. All right, again, the hepatitis B vaccine, it is free to you if you want it. It is effective on most adults. I have a family member who cannot take the hepatitis B vaccine because she has something where if she takes it, it'll kill her. So not for everybody. And then, if you're not vaccinated, which you can, interestingly, for this standard with OSHA, they let you decline the vaccine and you can continue to work, but then there's, additional precautions you need to take. So that is an option for bloodborne pathogens. So kind of wrapping this up, if there's an incident, you need to report it. Bloodborne pathogens can cause chronic fatal diseases. So, again, if there's any bodily fluids, blood, etc., you want to get it cleaned up right away and take care of business. So just so you know, we're about halfway through the training today, so we're moving right along. But yeah, it is important, if you're administering first aid, CPR of some form, you're protecting yourself as well and thinking about that. Obviously, we see somebody down and hurt. The first thing we want to do is help them. But we also have to think about ourselves so that any issue that they have doesn't become our issues as well. All right, so basic first aid and CPR. As I said, my name is Jonathan Greiner, and this is an area. I've had medical professionals in my family. Both my grandmas were in the medical field. My mom was in the medical field. My father was in the military, and he did a lot of field medic type stuff. So this is something that's kind of been around me my whole life. This is not a fully, it's not the 4-hour CPR first aid course or 5-hour, depending on which group you use. This is based on American Red Cross. It's the very simple, basic first aid and CPR, recognizing an injury, what to do for that injury, and how to get them to the appropriate people as soon as possible, and make sure that they're taken care of in the meantime. So very basic. So before giving care, we have some key points to remember. Here are those key points. The purpose here is to help identify and eliminate potentially hazardous conditions. As a first responder, not a technical first responder, but a literal first responder, you're the first person to the scene because you see it. Make sure that nothing else is going to happen to that person. Do they need to move away from an area? Does something need to move away from them? If someone was hit by a vehicle, for example, don't leave the vehicle in neutral uphill from that person would be a great example, right? If something fell on them and there's more stuff that's likely to fall, can we stop that stuff from falling or move them away from where that thing's likely to fall? That really needs to be our first, assessment of that situation. So the first thing we're going to do is assess. And then we're going to recognize it and make appropriate decisions. It's difficult to run through every possible scenario. As a safety person, I've responded to a myriad of different types of injuries, from frostbite to someone just dying in their sleep. And, in these situations, everyone is different what the appropriate response is. So really that's that logic and getting people involved to help make the right decision. So this course, again, teaches just basic stuff and the skills needed to give immediate care until more advanced. So we're kind of the middleman between the EMTs coming in and making sure that they're stable until that point. So if there's a diabetic emergency, the reason I put this one first is there's a lot of people with diabetes out there, both type A and type B, and it's a pretty serious disease. I talked about this last year in this training. I recently made a good friend with like a type A diabetic person who's like severely diabetic. Like they eat a sandwich, and don't manage it, like they could be dead by noon. It's like, whoa, like it's a very common and kind of crazy thing. So if somebody is a diabetic, usually they're going to have some sort of symbol on, like a bracelet or something, letting people know that. So if you find them passed out, you kind of know what the issue is. But if you see that, essentially the body's not producing enough insulin or does not use it effectively. If they're conscious and able to swallow, you're going to give sugar. If they can't swallow and unconscious, you're going to call 911. That's it, period. No, let's cool them down or get their feet up in the air. None of that. 911 right now. They're going to be able to take care of them. So for poisoning, not very common, but more common than you'd think. If you read through the OSHA, kind of injury log, which I know, like me, on the weekend, that's what you're doing. Just like, what's going on, in as if we don't have enough bad news, let's go find it. But there's actually a lot of poisonings that happen, usually through airborne concentrations of things. Typically, workers aren't drinking chemicals. It does happen if somebody puts a chemical into like a Gatorade bottle or a Mountain Dew bottle or something. But usually that's not a daily. But if somebody is poisoned, where a foreign, typically chemical substance enters the body, it doesn't have to be through ingestion, but anything, then, typically inhalation, again, is the most common. It can be swallowed or ingested. It can be absorbed on the skin. That's another common poisoning. Usually absorptions aren't fatal, but they can make you very sick. And then lastly, injection. Again, we talked about that. I've heard of a guy a couple years ago. he was using a hot, a pressure washer, hot pressure washer to clean, trucks off. He was cleaning his truck off. For whatever reason, looked down and his boot was dirty. So he's like, hey, I got the solution for that right here in my hand. So he takes this pressure washer, cuts through the boot, hits the bone. The water is such high pressure, it ricochets off the bone into his skin, up into his leg, like all the way up. I think it was past his ankle, if I remember correctly. And the reason he got sick was because the grease actually traveled with that water into his bloodstream and made him really sick. So that would be an injection. Not very common, but can happen. Treatment, poisoning, really, I'll be honest with you. The only thing you're going to do, you can call the poison center, and 9 times out of 10, they're just going to tell you what not to do. So that's what they're good for. But 911 is like the first thing if somebody really gets in a serious situation. And chemicals in the eyes would be considered typically a poisoning. So a lot of times 911 is just your best option. If the person's fine and they don't need an ambulance, great. But if they do, that reaction time becomes extremely important. So we want to make sure they get the care that they need right away. All right, so in any type of injury, so if somebody becomes unconscious at your workplace, or even if you're out and about in life, and we'll talk about the Good Samaritan rules here in a couple slides, but if somebody's unconscious, the best position to keep them in and to place them in is something called the recovery position. And that is what you see here in the image. Somebody, you essentially take their hand, you put it on their chin, and from the same side, you're going to lift up that leg and then flip them over so that one hand is under their head, and that same side that has their arm under their head, that leg is across their body. And that prevents anything from coming up from their lungs and filling their lungs, any mucus from them choking on mucus or vomit or anything of that nature. It keeps their airways open and prepares them essentially for medical transport. So before, if you're the only person there and have to call 911, before you do that, you want to put them in a position where they're safe and nothing bad is going to happen to them while they're waiting for transportation. So there's another thing I like to mention when we're talking about first aid, and that is what we've seen statistically when an incident happens, things that prevent people from acting to help that person. And the first thing is the presence of others. People will look around like, am I really the most qualified person to be doing this? I don't want to start doing this and someone to look at me and tell me I'm dumb and I'm doing the wrong thing. Also, uncertainty about the person's condition. Is this the right thing to do in this moment for this person? Fear of catching a disease, which is especially recently very reasonable. Fear of doing something wrong, being sued, or being unsure of when to call 911. And I've actually ran into this situation where somebody was in trouble and I got a call like, should we call 911? The answer, if you have to ask the question, should I call 911? The answer to that is always yes. Like, it's never like, 50-50. It's 100% certain. Call 911. Worst case or best case scenario, that person is fine, right? They you thought they were, knocked unconscious, but they're just asleep. And, for whatever reason, they wake up, they're like, oh, I'm fine, You can call 911 back and be like, hey, you know what? Cancel that. This guy's perfectly fine. Versus those critical minutes passing you by without calling emergency medical personnel. You want to make sure that the EMTs are getting there as soon as possible. Worst case, it's not necessary. You can call them off, maybe a small charge to somebody. Usually insurance will cover that because they'd rather pay for the EMTs to leave the shop and come right back rather than, having a much worse situation on their hands because they weren't called. Another element of that is the Good Samaritan law. So if in a workplace or along the side of the road, you try to help somebody, and obviously within your training, you're not doing an emergency trach, with a pen or something or a pen knife, like, this guy needs brain surgery on the side of the road. But if you're doing, your general getting them to safety, and they break a rib or, something happens to them that worsens their condition unintentionally, we are covered by something called the Good Samaritan law. And that means this individual is operating within their knowledge and within their level of training to help this person out. And obviously, as your level of knowledge and training increases, that changes, right? Like if you're a medical doctor and you come upon a car crash and you just push the person over the side of a bridge, to drown. You're like, well, I was just trying to help. That's probably not going to be I don't know, doctors who are doing this sort of thing, but that probably is not going to be a defensible act. But in your general run of the mill, like I got him away from the car was on fire and I pulled him to safety, and he broke his arm or his wrist during the process, like that's acceptable. Wrists heal, ribs heal, arms heal, death does not heal. So maybe, someday, according to the Bible in 1 Thessalonians 4, when Jesus comes back, we're all going to go to heaven, then death is healed. But until that point, a broken rib, that's okay. Wrist, etc. It's unfortunate, but getting somebody to safety is the important thing. So again, acting in good faith, are not negligent, and act within the scope of your training or knowledge. Again, no emergency trachs or brain surgeries on the side of the road. There's another element of this is consent, right? So one thing, if you've been following culture, consent is important in a lot of different ways. And in medical treatment, it's important as well, right? So let's say someone's having a panic attack, right? And you come up and you're just touching them and messing with them, and they're like, leave me alone. You're like, I'm helping, that can potentially get you in trouble. So the Good Samaritan law covers you in time of unconsciousness when that person's not able to, essentially provide that consent. But to obtain consent, when someone's in shock or has been through an accident, usually they don't just want a stranger grabbing them. And even people that are close to them just grabbing them. That's usually not the way you'd approach a situation like that. So you'd state your name. Hi, I'm John. It looks like, I'm trained in first aid. It appears that you've hurt your head. May I help you? I'm just going to move you over here so you can get some fresh air, or this car is on fire and I don't want you to, be harmed by that. I'm going to drag you over here to the side of the road, etc. You kind of want to talk them through what's going on in a very clear way. You don't just want to start grabbing someone and dragging them across the road, after a horrific accident, because that can increase trauma. So again, the idea of care is the whole element here. Incident management, case management, first aid, CPR, it all has to do with patient care, victim care, and that's really the point. So even in an emergency situation, to the best of your ability, you want to kind of let that person know that you're there to help them. Not like the government's here to help you, but actually help somebody. So going more in depth, that's just essentially before you even provided care, right? Like recovery position is kind of like the only procedure so far we've even discussed. Everything else has been pretty general, get consent, you're okay to help somebody. But now we're going to talk about specifics. So if somebody's in a life-threatening situation, unconsciousness we consider to be life-threatening because we don't know if they're passed out because they saw blood or because they had a heart attack. We have no idea. So unconsciousness is instantly considered a life-threatening injury. Not breathing or having trouble breathing, choking, persistent chest pain, no signs of life. Obviously, that's a life-threatening situation. Severe bleeding, shock, or seizures that recur and last more than 5 minutes. The reason they say that is some people have, short, small seizures, medical conditions, etc. So it may not be life-threatening. Maybe good to get them to safety, but maybe not, bring in the helicopter just yet. So some key points here. Why do people die? Some people would say it's COVID. COVID is still not the number one cause of death. It may be, comorbidity thing, but statistically it's motor vehicle crashes, falls, poisonings, drownings, and chokings are the most common reasons for fatalities. And two basic types of injuries that we see are soft tissue and musculoskeletal. So that's typically where we're going to see the majority of our injuries. Different types of wound. Again, a soft tissue is the most common. That's layers of skin, fat, and muscle. So, essentially a paper cut would be a type of soft-ish tissue injury. I mean, even if it's a small one, soft tissue. It could be at the skin level, such as a paper cut, or something deeper, requiring stitches. A physical injury that damages layers of skin is called a wound. Wounds are typically classified as either open wounds or closed wounds. And you'll see that a lot in injury, open or closed. And open essentially means, again, open to atmosphere, meaning oxygen's getting to it, bacteria is getting to it. That increases the level of severity in a lot of cases. So if it's a closed wound, essentially what we want to do is keep things from getting too swollen, because that restricts blood flow. So we're going to apply direct pressure, which keeps the swelling down. We're going to elevate the injured body part, which also keeps the swelling down, and then also keep it cool, but not directly on the skin, but typically some sort of barrier, even if it's a cloth. You want to keep it cool. Again, keep the blood flowing, not letting it swell up too much, because typically when the body has an injury or a problem, it's going to send a lot of blood there, which is good. But if there's some damage, that blood flow can be restricted and actually create clots, which can later cause other problems. So essentially caring for a closed wound, just remember pressure, elevate, and coolness, right? That's all you need. PEC. Types of open wounds, you have abrasions and lacerations. In a puncture, for example, you have your skin, the fat, and then the muscle underneath. It goes all the way through those, and depending on the level of abrasion or laceration, it can also go through all 3 layers as well. Controlling open wound bleeding, this is, again, very basic, right? We're not going through different types for punctures versus abrasions. We're just talking generals here. So elevating, the reason you do that, restricts blood. If you're losing blood, you don't want to send more blood to that place, right? We want to stop the blood through clotting, etc. At the skin level, and the way that we do that is by gauze. So if you apply a dressing and it needs another dressing, never tear off the first one. Just keep adding. It's kind of like license plate stickers, right? Just keep putting them on there, just over and over again, and eventually that's going to prevent the blood from flowing out and prevent that person from bleeding out. So open wound bleeding, again, gauze, roller-type bandages, and then you want some pressure there, so you want to make sure that you tie the knot over the wound, and then tape that dressing, and so we're applying the most pressure we can on the wound itself. And then the most important thing for that person at that point is making sure that they have circulation of their fingers and toes, because again, if our body's sending all of our blood to that wound, because you're cut, so it's sending blood there, but then you're losing blood, so that's a bad thing. So we want to make sure that our circulation is going good and the body's operating normally. For burns, different types of burns. There's thermal burns, chemical burns, electrical burns, and radioactive burns. So a lot of different types of burns. Depending on the type of burn, the treatment does change, and we'll go through those here in a moment. So in a minor burn, you definitely want to check, here's some do's and don'ts. You definitely want to check the scene for safety, like why is this person burned? Am I going to get burned, and helping them? Remove the source of the burn first. You want to cool first and second degree burns with cool running water, and then cover wound loosely with a sterile dressing. The reason, in this instance, unlike bleeding, that you want that blood to work for you, right? It's going to cool that wound down from the inside. So we don't want to pack it tight and apply pressure, because that's going to restrict blood flow, and blood is our friend in a burn situation. So don't use ice. Ice is not your friend in these instances. You don't want to break blisters. You do not want to remove pieces of clothing stuck to the burn. That's a burn unit group, right? Because you can actually tear into the muscle, even in the fat, when you do that. So don't use any type of ointment on severe burns. Not going to help you. Don't immerse them in water, and don't touch the area of a burn with anything that's dirty, because essentially whatever that dirt is going to embed itself into that wound and then fester and cause infection. So we want to make sure essentially you keep them. If someone gets seriously burned, basically you want to keep anything from touching it that's dirty. That's the most important thing. Water's not going to help you. Ointment, ice, there's nothing you can really do for that person except for get them to a burn unit immediately. Chemical burns, if there's contaminated clothing that's going to spread that burn, you want to get that off of them. Brush off dry chemical. Flush burn with water for 15 to 20 minutes of a chemical burn. Again, water's okay, ice is not. And then flush eyes of chemical in eye for 15 to 20 minutes. And that's pretty much across the board for anything in your eyes. All right, muscle, bone, and joint injuries. So there's 2 types of fracture. We talked about open and closed wounds. There's also open and closed fracture. Again, it has to do with whether or not the skin is broken. And then you have displacement, or dislocation, which is displacement of a bone at the joint, specifically. So not a broken bone. Obviously, a broken bone is something else. So then you have sprains and strains, which are much more common. A sprain is a partial or complete tearing or stretching of a ligament, and a strain is just a stretching or tearing of muscles or tendon fibers, typically at a minor level. These are usually not going to get worse after the initial incident unless there's too much pressure put on it. So essentially, what we want to do is get weight off of it, remove pressure, etc. So for shock, when someone has either been in an injury or seen somebody be in an injury, shock can happen. So what'll happen, and then internal bleeding will also turn our body into shock. Basically, our body's like too much, overloaded, don't know what to do. So in that case, you want to keep someone rested. You want to keep their pulse down because a rapid pulse is going to increase their level of shock. And then if someone does have internal bleeding, which again is a really big precursor for shock, you're going to notice tender, swollen, bruised, or hard areas of the body. So that area is going to be unnaturally hard. It's almost if it was a bone. So you're going to feel that difference. And then also a rapid, weak pulse. So very fast, but not very strong. Not a strong pulse. And then skin that feels cool or moist or looks pale or bluish. Those are also signs of internal bleeding. Now, typical day, you're not going to see that, but it is possible. Now, for minor injuries and care. So let's say somebody, they're out there, they tweak their back, right? They step on some scoria, and this happens a lot. Their ankle, just isn't quite tight. It's feeling rolled or sprained or something. Unless you're a medical professional, you don't want to assess that injury and provide consultation for care. That's where you can potentially get in trouble. Like, Billy, you're fine. You don't need to see a doctor. And then he did need to see a doctor, and he's going to be like, I didn't go because Billy told me not to. That's not a good situation. You kind of want to operate, again, within your level of knowledge and experience. So there are companies out there that do initial assessments of individuals for minor injury. Now, guy loses a finger, you're not like, we'll see how it feels in 10 minutes. You're not doing that, right? That guy's going to the hospital. But guy, again, hurts his ankle, sprains his back a little, it strains his back. It's like, man, I'm not feeling very good. That may not be an initial, get him to the emergency room. So there's two different, so a couple other things. People do have a right to see a medical professional, but it's common practice for them to go to an occupational physician rather than an emergency room for non-emergent situations, which just makes perfect sense. So there's a bunch of different companies out here. Extreme MD actually has physical offices around the Basin. Landmark Medical is another one. And then you have companies like Axiom and Work Partners and Extreme MD where it's a telemedicine situation where you can call an 800 number and they're going to tell you, essentially you're going to give them the nature of the incident, and they'll tell you whether or not that person needs to see a doctor or needs additional care if it's in question, right? So there's a bunch of outfits out here that do this. I'm going to include a link actually in this training. Right below the video there, you're going to see a link where you can click it and it's going to show you where every occupational physician is in North Dakota, in the western North Dakota. So if you need to go, you can pull this. I'm sure you're just going to have this saved on your home screen of your phone because you're cool like me, and you can click that and it's actually going to show you where these people are. And what that also does is it prevents some emergency rooms, like they're busy, they're packed. You come in, you're like, my arm hurts. They're like, here's some Vicodin. That may be an instant recordable injury when it's not a recordable injury. It's the idea isn't try to get away from it, but not to overestimate an injury rather than underestimating it. So our last training today is the illness prevention. So obviously, first aid is important, but the best thing we can do to prevent that is preventing injury or illness. And specifically for this one, we're talking about COVID, the flus. I'm surprised we're having to do this 2 years later. I thought we'd be well beyond this now, but as we've seen, this thing mutates and changes. So the reason we go through this essentially is obviously to provide safeguards against infection if we can prevent it, and then some means of if you do have it, preventing from spreading it to others. So our goal is to keep the number of people that get viral infections low, and then keep the business operating as best as possible because we don't want people to be sick. So before you even leave the house, I like to start there. Make sure your stuff's clean, practice good hygiene yourself. If you're having food, pack it into sealed bags, lunch boxes, use mouthwash, keep yourself clean. And then temperature, and not so much even more with the new variants, but in the older ones, your temperature will increase, with COVID. So if you're traveling around, not a bad idea to use gloves in public spaces. It's just not a bad idea if you can. And, if you're touching things and people that other people have touched, again, hand sanitizer. This is nothing new. I'm not going to pretend we're, changing the world here with this knowledge, but, we got to go through it. So we're going to make it through it. And it really is, it's a lot of common sense, right? Keeping things clean, work surfaces clean. If someone's been sick, in an area, cleaning that stuff, and handshaking, I think we've kind of moved back into that. And I think more or less we've seen, a significant drop. So people are becoming less concerned. But good practice is, you don't know somebody, don't be touching them a lot. Just not a terrible idea. Anyway, PPE in shop. Again, and one thing that's unique that they did since we first created this training is, and I kind of mentioned it here, is they consider people that you work with every day almost like a family, right? So you don't need to treat the people, now depending on the size of the workforce you work with, right? Like if you work with the same 3 people every day, every single day, day in and day out, we don't want to treat them like complete strangers. Again, we want to avoid the hysteria that surrounds this. In a lot of cases, they've considered that a work family, meaning like, hey, these are your people. But you also, just like your regular family, you want to prevent them from being sick. So if you're going to be working with them, then maybe let them know if you don't feel well. Keep people communicated with. So hygiene, just like I mentioned in other areas, keep things clean, keep your hands clean, keep your breath clean. These are things you should be doing anyway, but it does help prevent the spread of diseases. So if you can avoid the public places, more or less, just pick your battle. Like, is this something I really want to do? Okay, then maybe wear a mask depending on where you're at. And just like anything, with COVID protection, we've heard about it: mask, gloves, and hand sanitizer. And distance, those are like your best friends. The other thing I want to mention before we wrap up is if you do feel sick, right? So they lowered the quarantine period to 5 days now. So, which is good. I mean, one, because, it's a reasonable period of time. But two, like if you're not feeling good one day and you can't get a test, like no one's you typically have like a COVID test in their back pocket. Just say, hey guys, I'm going to get checked out in the morning. Give me a little bit of time to get checked, because people don't want to miss work if they don't have to. And if you have a cold, it's not a life or death situation. Go get checked out. Take a day. Worst case scenario, you're out for 5 days, right? So we're not talking 2 weeks, a month, whatever it used to be. But get checked out, make sure you're good. Don't spread it around. If you feel like you're not, feeling so hot, get tested, communicate that effectively. But in a lot of cases, we've had people who just got, like, that's our policy at Basin Safety. Somebody says, hey, I'm not feeling very good. We're like, all right, well, do you feel like you can work? Yeah, I feel like I can work. I just, I don't want to get anyone sick. All right, take an hour, go get a COVID test. Let us know how it is, and then they're back to work by 9 o'clock or 10 o'clock in the morning. Not a big deal, so it's just extra steps and precautions. What you don't want to be is somebody who gets sick and just doesn't tell anybody and is like, we'll figure it out. And then you got 15, 20 people out from COVID. Obviously, the initial concern, which has changed, was everyone's going to die if they get COVID. We've seen that statistically is not the case, but because of the regulations and mandates and everything, we do have to protect people. And so we don't want to have a whole office shut down because one person just didn't communicate or think it was very serious. So a little bit of personal responsibility there. Again, we don't want to blow this up. There's enough people doing that, but I'm just giving you some common basic steps to protect yourself and others so that, again, the hysteria is avoided. So that's all we got this month. Very grateful for you guys tuning into our stuff and paying attention. At the end here, obviously, there's a quiz. If you want to review us on Facebook or Google, I think we're going to give away a shotgun here in the next month. So if you put your name in, you'll have a drawing for that. If you just write a review on one of those things. I think we're also on Yelp and LinkedIn and a bunch of places. So let people know you like us. Let people know you hate us. Don't be too harsh. And look forward to seeing you next month.